I think that this is probably one of the largest things that's ever happened in the United States. And if you kind of trace the history of healthcare in the United States, you will see that president after it started with Teddy Roosevelt. He tried to bring in reform. He didn't make it. And FDR tried to bring in reform, and Harry Truman, and Nixon, and Gerald Ford, and finally we got a little bit of glimmer when the Clintons came in. But we've been working on this project for a long time, okay? Whether you like Obamacare, whether you don't like Obamacare, whether you like parts of it, you don't like parts of it, what I want you to realize is that it basically is going to give, and I wrote it out, it's going to give better access to providers and better equality for our medicine. And you don't remember anything else. Remember access and equality, because that's what it's going to do for us. All right? There are several, what do you want to say, paragraphs in the law. The law is 2,309 pages. It'll take you about, if you're a really good reader, it'll take you about 40 hours, barring if you might take a few naps. And now, as of the end of 2012, there are 70,000 pages of regulations. It's a lot of things to wade through. And so what we've tried to do, and I didn't do this all by myself. I've asked several people to help. One, I asked a CPA, because there's going to be some financial implications in this law. And so he's given us some information. And then I asked Sam from the insurance network, AAC Insurance Network, to kind of give us some information. But this is fairly self-explanatory when we finish going through it. But what I want you to realize, the number one thing for providers in California is, as of December 2012, Governor Jerry Brown signed 2 laws. And those 2 laws basically state that every health insurance company has to cover acupuncture services in the state of California. Now, how did that exactly happen? Well, about 4 years ago, we established what they call a California Health Exchange. And it's made up of 16 good and true citizens from California. And they read every single health plan that was submitted, because California decided that they would make their own decisions as to what services would be covered. Well, they finally chose the Kaiser plan. Now, that's the plan that is going to be the basic plan that people can buy. And that Kaiser plan, because of American Specialty Health, which is the managed care company that lives in San Diego, covers acupuncture. So that's part of the reason you got in to the list of what they call essential health benefits. And the definition is in here. Essential health benefits is the services, the names and the kinds of services that are going to be covered. Now, someone asked me today, are they going to pay $10? Well, I don't think so. I think they'll be paying more than that. But the thing that I want you to realize is, everybody that has insurance, and with Obamacare, you're required to buy insurance. You have to buy a policy. Well, as of this week, the price of the policies, they're finding out, will be able to be reduced because so many people are buying policies. People that may not have bought them before. Now, there are some tax implications. Number one, if you do not purchase a policy and on your 2014 taxes, you don't buy a policy, there'll be a penalty. The penalty will be attached to your federal taxes. It's only going to be $95. So there will be people who will opt out from buying a policy. In 2015, that amount goes up, as of now, goes up to $395 as a penalty. And then the next year, which is 2016, it goes up to $695. So you can opt out. Okay? Some people will. Some people will buy the policies. There are all kinds of implications for employers. Okay? All kinds of financial things. One of the other things is that because it is essential health benefits, Medi-Cal will be coming back into the picture in the state of California and will have to pay for acupuncture services. That benefit came to patients back in the late 70s, 1978, and then about 4 years ago you got cut out of Medi-Cal because of budget constraints. Well, you're now back into Medi-Cal. And those all begin January 1st, 2014, which is not very far from now. So think about the fact that it gives you huge amounts of potential patients. We have a population of about 38 million in the state of California, and all of those people somehow are required to have insurance of some kind. Now, there will be lots of different companies selling policies. So you'll have to look at what kind you're going to buy or whether you're going to opt out or that kind of thing. But I want you to realize that your patients will come in. So you'll have to become somewhat knowledgeable with insurance. And I just want you to remember that insurance is a game. And this is a game that we'll probably be playing for a while. So let's look at some of this handout. It talks about, it says the Affordable Care Act, right on page 1. And there are a number of what I call acronyms, a lot of titles, and there's some titles in here. The law has 7 different titles in it, and I've given those to you, okay? It can be called the ACA, the Affordable Care Act, or the Patient Protection and Affordable Care Act, and you'll see those initials in lots of different places. There are mandates, and a mandate is that they have to cover certain things. Acupuncture is now done that. And how it will affect us in California? It may increase the availability of acupuncture and will create changes on how we practice. And I put something down at the bottom. CAM providers are going to be in this law. It is going to bring this medicine up into view of everybody. And CAM has always meant complementary alternative medicine. And I decided that it's going to stand for chiropractic, acupuncture, and massage. And I like that, okay? And I presented that to a group in Chicago of large employers, and they sort of liked that, all right? There are titles in the law, and I'm on 2. There are 10 different titles, and I'll just read them over, but I want you to take them home and use this as a reference, okay? Title 1 is the affordable, quality, affordable health care for all Americans. And it's 374 pages. It deals with health insurance. Each one of these titles is within the large act. The role of public programs. Then we have improving quality and efficacy of health care, prevention of chronic diseases and improving health. Then it goes the healthcare workforce. We're going to talk about a lot about that. Transparency and program integrity, improving access to innovative therapy, community living assistance services and support, revenue provisions, and strengthening quality, affordable care for all Americans. Those are things you can look up under. You may not have to read the entire act if you don't care to, or you could read it over the next 3 or 4 years. Better access for patients. Patients have better access to you, and equality for CAM providers. And I think that's probably one of the most important things to remember. This act wants to focus on quality of care, patient safety, and patients having access, and patients are going to have the ability to access their own records. One of the things that will have to happen when you move into electronic healthcare records. Now, If you're in Medicare, which acupuncture is not, and we'll put yet, you would have to have electronic records both this year and next year. I think that probably because we're not in Medicare, you probably won't be required to be into electronic records until about 2015. But that's a guess right now. When you do get into electronic records, if the patient requests, you will have to supply them a copy of their health care records for that day when they leave the office. You actually have 3 days to get them to them, so you have a little bit of a window. But they have the right to have their records. So that's going to be an issue that's going to come up. The Health Care Reform Act, and this is done by years, all right? So in 2010, which is already passed, so some of the issues with the Health Care Reform Act has already been enacted. Young adults will be able to stay on their parents' insurance until their 26th birthday. A lot of young people have done that. Insurers will be banned from imposing exclusions on children with pre-existing conditions. Pools will cover those with pre-existing health conditions until health care coverage exchanges can be operational. I want you to know everybody is scrambling right now, just like we are. I get emails from the American Hospital Association probably 2 or 3 times a week. I get them from the Hospital Forum. They're all looking as to what they can do and how they have to do it, because everybody comes under this, all right? Insurers will not be able to rescind policies to avoid paying medical bills when a person becomes ill, so it should be a little easier to collect money. Lifetime limits on benefits and restrictive annual limits will be prohibited. So for older people, that's probably good news. New plans must provide coverage for preventative services without copays. The insurance policy that the Archdiocese of Orange County now has, if one of their insureds will fill out a health care survey every month to tell them how much they exercise, the kinds of foods, maintains their weight, that kind of thing, the insurance carrier will send that patient a $100 check. We're beginning to look at prevention. That's where acupuncture should belong. The problem is we don't have any research on prevention yet. So where you belong right now, or where you fit into this plan, is rehabilitation. And they're looking at restoration of function, and you will have to document that restoring of function. And you're going to relate it to the activities of daily living. So I recommend that you type into your computer activities of daily living, and out will come a real nice list. It's an easy way to document it. When you put it, when they restore function, all you're going to do is ask your patients, what can you do better this week that you couldn't do last week because you had an acupuncture treatment? They may be able to stand longer, sit longer, ride in the car. Maybe they can lift something they couldn't lift, but you look at your list of activities of daily living. Okay? A temporary reinsurance program will help offset the cost of coverage for companies that provide early retiree health benefits for those ages 55 to 64, and that's one of the biggest issues for people. New plans will be required to implement an appeals process for people who don't feel that their benefits were paid correctly. An adoption tax credit and assistance exclusion will increase by $1,000. The bill makes the credit refundable and extends it through 2011. Businesses with fewer than 50 employees will get tax credits covering 35% of their health care premiums. So a lot of the burden for money goes on to health care, goes on to businesses. Now the IRS came out with a white paper saying that they estimated that health benefits would cost about $5,000 per person per year. Well, for a family of 4, that would be $20,000 per year. But that family of 4 then gets a tax credit back on their income tax for $2,700 per person. So even though they put out the $20,000, they get a tax credit back for $12,000, which means it's like $2,000 a person. Okay, so they're trying to look at that. Okay, 2011, Medicare will provide free annual wellness visits and personalized prevention plans. So one of the things this profession has to do, in my opinion, is to really begin to organize, become strong, and look at should we or should we not be in the Medicare system. That will require legislation through the Congress of the United States. There are several other things. Should we be in Veterans? Should we be in TRICARE? Should we be in CHAMP VA? Those are the kinds of things we have to look at, and all of that comes through the Congress of the United States. So here's my little plug. We need to be a member of a national association as well as a state association. Okay. A plan will provide a vehicle for small businesses to offer tax-free benefits will be created. It supposedly was created. It's a little bit slow. This will ease the small employers' administration burden of sponsoring like a cafeteria plan. A cafeteria plan is where people have lots of choices. The Medicare payroll tax will increase from 1.45%. If you earn less than $200,000 a year, you pay 1.5% on your taxes into Medicare. If you make $200,000 or more as an individual, or $250,000 as a family, it goes up to 2.35%, and that has already kicked in. So if you are in those income brackets, you will know that in 2011 that happened already. Okay, 2012 and 2013, we have implementation of essential health benefits. That's what we were talking about at the beginning. So the beginning of 2014, every person who has insurance, a health insurance plan in California, will have acupuncture benefits of some kind and variety. States decide the minimal health insurance plan or allowance. In California, we chose the Kaiser plan. All plans must then cover the minimum that these plans offer. So everybody has to cover acupuncture because you're in the minimum plan, right? If chiropractic, and I put in here chiropractic and acupuncture because chiropractic didn't make the list of essential health benefits in California, but they had provisions in the entire Obama healthcare plan that they would be covered. Is decided in a state as an EHB, it will mandate all plans have those benefits. And that, I think, is an important piece for us. Okay? In 2013, health plans must implement uniform standards for electronic exchange of health information to reduce paperwork and administrative costs. That is coming. Do not purchase an electronic records system yet. They are very expensive. That's the first thing. They're very expensive. And the bugs aren't all worked out of them yet. But it is coming. We will be doing it. And one of the acupuncturists who went to work for Kaiser in Northern California said to me, when I went to work for Kaiser, Kaiser came to me and said I had to read the electronic healthcare records. And he says, I told the CEO that I didn't need to read healthcare records. I was an acupuncturist, and we didn't need to read the records. And he said, the requirement is that you read the records. And he says, well, I don't need to read those records. CEO said to him, if you're going to work for Kaiser, you will read the records. He said, okay, I'll read the records. He says, I've now been at Kaiser 6 months. I have been reading the records, and I have found that it is infinitely easier to make my Chinese medicine diagnosis after I've read the records. So you will be required to read people's records before you put your input into the records, okay? So just get ready, It's coming. Okay. Contributions to flexible savings accounts will be limited to $2,500 a year, indexed by the Consumer Price Index in subsequent years. Many of your patients have flexible savings accounts or medical savings account, and they can pay for acupuncture care through those. The IRS has also issued a letter that says if a flexible savings account or a medical savings account will not pay for herbs, some cases they won't, but if they will not pay for herbs, that the patient may use the cost of herbs that they pay you. As long as it is 7% of their income, they may subtract it or use it as a tax credit on their federal income tax. So probably one of the things you'll need to start looking at is how much do your patients pay you in herbal products. So probably your records will have to be quite good. The increase to the income threshold from 7.5% to 10% on adjusted gross incomes. Those older than 65 can claim 7.5% deduction through 2016, right? 2.9% excise tax on fiscal sales of medical devices will be established. Supposed to be established this year. Accepted are eyeglasses, contact lenses, hearing aids, and other individual items or items for individual use. Okay. 2014, we have the Non-Discrimination Clause. This is a clause that's in the big law. It's section 2706. And it basically says non-discrimination in health care. No health plan or insurer may discriminate against any health provider acting within their scope of that provider's license or certification under applicable state law. This will ensure that insurance companies cannot unfairly exclude doctors of chiropractic or acupuncture from practicing under the capacity of their training and licensure on the federal level. Now that is good news for us, ladies and gentlemen, because acupuncture has been included in 6 states, like it is in California, as an essential health benefit. But non-discrimination says that they can't exclude them in the states that they didn't make essential health benefits. The states, when this law was signed into law by President Barack Obama, the states kind of looked at it and asked questions, but they gave the responsibility of choosing which services, medical services, would be covered in the states. Well, Kathleen Sebelius, the Secretary of Health and Human Services, looked at that and thought, I'm not going to do that. So she sent it out to the states, and the states have 3 choices. They may either establish their own health exchange, as we've done in California, and several other states have done that, or they may say, we're not going to do that. We're going to refer back to the national plan, or the states may opt out totally. So far, 2 states have opted out. Florida and Texas have opted out. They said they're not going to participate. We have yet to see how that's going to work out. Well, Texas and Florida, you know, it's okay. Okay, so provision is a federal protection applicable to the ERISA and other plans established or regulated under the bill, just as the HIPAA protections now apply across the board. The non-discrimination provision will be applicable to all health benefit plans, both insured and self-insured. That's a non-discrimination clause. That covers you. We may have to push, we may have to gently fight, but you are in the law and you are included. And a group out of Washington, D.C. worked very hard to be sure that you got included in the non-discrimination law. And that was headed by Sherman Cohen, who has been a very big advocate for 40 years in acupuncture, even before we were licensed in many areas. He teaches jurisprudence at Georgetown University to the law students. And he headed that group, and he worked very hard to get you into that. Okay. Community health teams, National Healthcare Workers Commission, chiropractors were members of those. The teams support the development of medical homes by increasing access to comprehensive community-based coordinated health care. Now, a medical home is going to be established. You are not mandated to be in the medical homes. What is a medical home? A medical home is a group of medical providers. The American Hospital Association is looking at this saying, we need physician leaders. So they're taking doctors from across the country and they're training them how to put together a group of medical providers. In California, you should, could, and hopefully will be a member of a medical home. Now, what will happen in those medical homes is there will be a provider of every different specialty. All right? They will need an acupuncturist. The homes can be small, they can be big. It doesn't mean you'll all necessarily be working in the same physical location, but you will work together as medical providers. The next difference is going to be that right now on insurance, you are paid what they call fee for service. You bill an acupuncture treatment, it's a fee for the service you provided. Well, they're going to change the method, and this is not coming in 3 weeks, okay? This is down the road a little piece, but they're going to change the method of how you get paid. You're going to be paid in a lump sum. You will be paid per diagnosis. So let's say that someone comes in and has swelling and a painful knee, okay? They're going to look at that, the diagnosis, they'll put the diagnosis together. Then the insurance companies will say, okay, we're going to pay so much for a diagnosis, okay? Well, the medical home is going to say, okay, we only have so much money, so we're not going to send them to surgery first. We're going to try, what kind of care? Conservative care. It will be your responsibility as a provider in that medical home to explain to them why you should be the first provider to treat for a particular condition, whatever it might be, if it falls within your scope of practice. So we're going to have to do a lot of work in communication. We're going to have to be able to talk to those medical providers. We're going to have to be a little bit persuasive in what we tell them to do. Now, we have another group out there who is working from WHO, and we talked a little bit about it last week, the quality of care and patient safety. Well, quality of care, they want to start with the least invasive before it goes to the most invasive, which would be surgery. Well, you are the least invasive. So you have to think, who do I know? Who do I communicate with? Who am I going to work with? It'll be a big job, okay? Not everybody do you want to work with, okay? But we'll need to put groups together, okay? We're also going to be, the National Healthcare Workforce Commission is looking at what goes on in the workforce, okay? Last piece, citizens will be required to have acceptable coverage or pay a penalty, and there's your numbers that you have to pay. Then it says families will pay half the amount for children up to a cap of $22.50 per family. After 2016, penalties are indexed according to the Consumer Price Index. Okay? We're still in 2016, I believe. Workers who are exempt from individual responsibility for coverage but don't qualify for tax credit can take their employer contribution and join an exchange plan themselves. There will be lots of different plans out there. How many people in here are getting things on your email about health plan quotes and that you can buy insurance? Anybody? How many do you think you get a week?
Probably a couple of months,
Oh.
from Kaiser.
Kaiser, okay. Anybody else? Okay? I'm getting probably 3 to 4 a day. And it could be maybe because I have an insurance license, but they're out there. They're beginning to market to everybody. Okay? All right, then it talks about companies with more than 50 employees must offer coverage to employees or pay a $2,000 penalty per employee. So most of them won't want to do that. Insurers can no longer refuse to sell or renew policies because of an individual's health status. Health plans can no longer exclude coverage for pre-existing conditions, and insurers can't charge higher rates because of health status, gender, or other factors. Okay. Health plans will be prohibited from imposing annual limits on coverage. Okay. Limitations, and when you verify insurance, you'll find this out. Health insurance exchanges will open in each state to individuals and small employers to comparison shop for standardized health packages. Health or credits will be available through the exchange for those whose income is above Medicaid eligibility. And then Medicaid eligibility will increase to 133% of the poverty, and that you'll need to look up numbers for. In 2018, taxing Cadillac plans and excise tax will be imposed on high-cost employer-provided health plans beyond $27,000 for family coverage and $10,000 for single coverage. So employers would be paying extra taxes. All right, and that's where we got it from. Okay. Healthcare Reform Act. An official state legal counsel was asked the following 3 questions about how the provider non-discrimination provision, Section 2706 in the Healthcare Reform Law, will impact states' healthcare reform activities. And he answered, I'm going to let you read those. I'm not going to read those to you. I'm going to let you read those, but he answered no, yes, and yes, and which means they can't discriminate. This was all envisioned 3 years ago. It is incredibly exciting to see a third-party, independent legal expert view that the law we hoped would be enacted is actually going to be enacted. Okay. There's some other things there I'm going to let you read. And then on the next page is, where are we now? This is why we need reform. The U.S. ranks, and it says #1 in obesity, but I want you to know that as of 3 weeks ago, we are #2. Mexico has taken over on obesity, okay? We're number 50 in life expectancy. We're 30th out of 31 countries in infant mortality. We have 26.6 MRI machines to 1 million people. We have more MRI machines than any other country in the world.
Is that bad?
Well, I don't know. They cost a lot of money, okay? We use them for a lot of things, except we only use them for diagnosis here. Other countries in the world use them for healing modalities, particularly Korea. Okay? We perform 91.2 to every 1,000 people get an MRI exam. 45% more coronary artery bypass grafts than any other country, and we're the 4th highest per capita in consumption of prescriptions. Okay? And prescriptions are going very high, ladies and gentlemen. Listen to this. We could change these stats if CAM providers were part of the team. Okay, why do we need to reform? Well, #1, we have a provider culture. They only get paid when they perform tests. They don't get paid just to see you. They have to perform some type of service. Fee for service. So they want to change that. Medical malpractice and defensive medicine, that's what they practice. Patients consider high technology and more tests to be more thorough and have better health care because of the way we have marketed to them, because we have direct-to-consumer marketing, and third-party reimbursement shields patients from the true cost of care. All right. Then I thought this was, pretty interesting. Great works in their words. The Gettysburg Address has 272 words. The 10 Commandments have 313 words. The Declaration of Independence has 1,137. The U.S. Supreme Court decision was 193. And the Affordable Care Act has, it actually has 2,309 pages and now 70 pages of regulation. 70,000, sorry. 70,000 pages. I don't think we could even read through that, could we? Okay. So here's, they're saying that we're going to have transparency for stakeholders. Patients are going to have more availability to information in this act, they hope. Okay, it's going to be patient-centered care. They are to become active participants. They receive services designed to focus on their individual needs, a high level of patient engagement. This is what you do. You're already there. Okay? The Affordable Care Act, we have the definition of a provider. And it is a healthcare provider, means an individual or entity licensed, registered, or certified. That is you. And you're required to be licensed, registered, certified unless you're exempted. Well, you're licensed in this state. Here's your non-discrimination law again. The next ones, we have community health teams. Chiropractors have been made it in 46 states as that, but you also will be in this because they're going to be multidisciplinary. And then we have the Healthcare Workforce Commission. Chiropractors got themselves put into that. Essential health benefits. It's an approach to defining essential health benefits, what it is, how it is, okay? Quality of care and patient safety. This is the new classification from the World Health Organization. Acupuncture, herbal medicines, and manipulative therapies are included. And on September 10th, we are presenting our first, what they call linearization, to this group in Washington, D.C. And I'm very excited because the people who worked on it have done an outstanding job. But you are there equal with medical doctors when it comes to quality of care and patient safety. So congratulations. All right. The next page is what you need to do as far as an exam when you do it, and this comes directly from the CPT codes. That's another issue. Your ICD-9 diagnostic codes, we use ICD-9, those are going to change to ICD-10. They will change October 1st, 2014. So right now in ICD-9, we have approximately 14,000 diagnostic codes. In ICD-10, there will be 68,000 diagnostic codes. So take about 25 ICD-9 codes that you can use, and it'll turn into about 160 ICD-10 codes. They're a lot more what they call granular. They're much more specific. They've added things like right and left and flexion and extension. And so you'll probably be wanting to know. The codes look totally different. ICD-10 is usually 3 numbers with a decimal and a couple, 1 or 2 digits behind the decimal point. These all have a letter in front, starting with A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, and then some codes behind it. And but you will be able to buy a book. The AcuCode book is taking all of the codes that you've used before and has synced it up with the ICD-10 codes. So on September 30th, you can use ICD-9. October 1st, you'll be using ICD-10. Now, we were supposed to go to it this October, but the medical doctors, the American Medical Association, sued the Department of Health and Human Services because it's going to be a big jump for them, and they won, and so it got pushed back to October of 2014. Okay, and then I've given you 3 pieces that I think you'll find helpful for you. I pulled out from the workers' comp law for you the Acupuncture Medical Treatment Guidelines. These are guidelines by law, state of California, Colorado, Massachusetts, and New York. And it basically says that acupuncture can be used to reduce pain, reduce inflammation, increase blood flow, increase range of motion, decrease the side effects of medication-induced nausea, promote relaxation in an anxious patient, and reduce muscle spasm. Those are your those are your words from the law in the state of California. I'd recommend that you memorize them and be able to give it back. Electroacupuncture, physiological effects depending upon the location and the settings, can include endorphin release for pain relief, reduction of inflammation, increased blood circulation, analgesia through the interruption of the pain stimulus, muscle relaxation. It is indicated to treat chronic pain conditions, radiating pain along a nerve pathway, muscle spasm, inflammation, scar tissue pain, and pain located in multiple sites. There isn't much they missed, is there? Now, what are your chronic pain for the purpose of acupuncture? Means pain that persists for at least 30 days beyond the usual course of acute disease or reasonable time for an injury to heal. That's in the law in the state of California. Okay? And then chronic pain disorder guidelines. These come out of the labor code. And it says time to produce an effect, 3 to 6 treatments. Frequency, 1 to 3 times a week. Optimum duration, 1 to 2 months. Okay? Now, with electric stim, it talks about that. And then the last part that I've given you is specific guide to language sections on CAM and integrated practices in the healthcare. And it's just a group of news articles, and it actually has the picture of the people who put the wording in the law.